Archway of Opportunities is a scholarship program. It can include the crew members and it can include managers. The scholarship is $2,500 for crew members and it's $3,000 for managers. For my store alone, we've had $35,000 go out just in 1 year. And for all 7 of our stores, we had $66,000 in scholarship funds.
With our announcement today with Fayette County Memorial Hospital becoming part of Adena Health, what it's going to mean for the area community is, we've had a clinical affiliation for the last couple years, but there were things that we could not do because we were not one. And now we've become one family, and it's going to allow us to expand different types of services into the hospital, even more than what we've already done. It's going to create new specialty access that this community has not seen in years. So yeah, it's a big day. It's a big day for the residents here and being able to expand their personal access to great care.
You watch days cash on hand getting lower and lower. We're a small community hospital. It's ultimately the number of people you get in the door and stay in the hospital that help drive the revenue. And those numbers weren't there. Financially, the hospital would not exist. We had overtures from other hospital systems, and in talking to them, it was always like, oh yeah, we'll like triage here and send you to Dayton or send you to Columbus. And with Adena, Jeff's comment, his literal quote was, "I'm not interested in building more beds in Chillicothe. I want to keep the beds where they are." And that, it was a perfect fit.
During our due diligence process, we were looking at the capital investment needed into the existing hospital. And then we looked at the future and the cost that we would be looking at to maintain that older facility. And we started doing the math and talking through what would it look like to replace this facility that'll carry us well into the future for many years. And it made a lot of sense, and that's why we are here today announcing we're going to build a new hospital. Now, the timing of that new hospital, we've already, as I said, we've already started discussions. We've already had folks looking at the size, the costs, and all those things. And so later this year, there'll be information coming out on the exact timing of when it's going to start. Our plans would be to really get into formal plans to where we would be talking groundbreaking by the end of this year into the first quarter of next year.
The hospital board did an excellent job of what they was doing. It was just a sign of times, and we need a new hospital, and we was realistically probably some people are not using our local hospital because of the age. So this very exciting. It's just going to be. It'll pull people in from other areas, we're sure, and it'll make it more profitable. That's what, just like anything, you can't survive without making money, and hopefully this will make it all work and everything be a lot better.
I had a blood draw earlier this week, and I news was already out, so I said, "What do you think of Adena?" And she goes, "Well, I used to work at Adena. Now I work here because it's more convenient." And she goes, "So I only think good things." And that's the other thing with Adena. Culture has always been every place I've ever worked. You're inculcated with the culture of the organization. And that's what brings people in, and that's what keeps them there. And the community that Mike has instilled here, the just practice and things like that, you see a change in the culture in Fayette County. We would have hated to have seen that go away. And from everything I've dealt with, I've met with people from Adena for like the last 3 years. I went to their board retreat a couple years ago. It's the culture of their organization that it's such a good fit, and the character of the management. In my working life, I'd been acquired a couple times, and you never know what promises are made, but it comes down to the character of the people, and you can judge that pretty well. And with Jeff and Kathy and everybody, it's going to work really well.
If you just look at some of our other campuses, whether it be in Waverly or Greenfield or Jackson or Circleville, it just allows us an opportunity to expand and be able to have primary care, great primary care access, and actually have everyday services here that maybe haven't been here for a while. By having Fayette and Adena together as a partner, it just really strengthens the ability for access to great care.